Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Hello, thank you for tuning in to another edition of Ask the Chiropractor. I'm Brant Hulsebus here in Rockford, Illinois, and I want to dive into a little bit of topic that I couldn't help but talk about last week when we talked about bad neck posture and the tech neck stuff, and I wanted to dive into this. It kept coming up. It was headaches. So I want to discuss a little bit about headaches if I could. Headaches, common thing that we see all the time in chiropractic. People come in and tell us they have headaches all the time. We have a lot of new patients that come in with lower back pain, neck pain, or headaches. We've had great success with headaches. And I'd like to maybe describe to you what's going on with the headache and why chiropractors do well with headaches. And maybe some of this might hit home with you. Now, I've been able to study with some really awesome upper cervical chiropractors because of my connection with the Rockford Ice Hogs hockey team. You see, the concussion chiropractors and the headache chiropractors do a lot of the similar work. And I've had to study with the best concussion doctors in the world. I didn't say chiropractors there, I said doctors, because little secret to you, the guy at Harvard University in Boston, Massachusetts, that's leading the head injury area there is a chiropractor. And I've had lunch with him a couple times, and we've gone to several of his lectures. But let's go talking about headaches again. What's going on when you have a headache? If every time you get a really bad headache, you want to go to bed early and sleep it off, that's not the reason why you're having headaches, because you're not going to bed early and sleeping it off. If you're having really bad headaches, you use a cold compress to give you a little bit of relief. That's not why you're having headaches from a lack of cold compresses. If you're having headaches, you say, I need to drink more caffeine or have more sugar, this and that. That's not why you're having headaches. Headaches are interesting to chiropractors because when we study neurology from the same textbooks your family doctor studies from, we know that the brain itself cannot perceive pain. So the brain itself does not feel pain. It can receive pain from other places. It can tell you things hurt. But the brain itself has no pain receptors. So if you go back and think about John F. Kennedy, our former president, he had a younger sister. And during that time, typically women they did this to. Typically women would talk back or have an attitude or this and that. The husbands would say something's wrong with them, or the father would say my daughter's not right. And they would want to fix them by going up their nose and cutting off the front part of the brain. They call it lobotomy. And you would never feel the knife cut through your brain. That's why they considered it to be kind of safe and humane, because it didn't have that kind of pain to go with it, because it was just simply the knife going through the brain. I don't recommend this, so we stopped doing this a long time ago, but the brain cannot feel pain. So when you have a really bad headache and everything up there is pounding, you think your brain's screaming, but it's really not. So what is it? What's going on? Why do we get these headaches? I'm going to talk about one of the most least common form of headaches, and that comes from your tailbone. You see, your tailbone, when you walk, it rocks back and forth, and it acts as a mechanical pump to move your spinal fluid up and down. We are mammals that walk on 2 legs, not on 4, so we don't have the benefit of being horizontal with our spine, say your pet dog or your pet cat. Our spine's up and down. So when we walk, our sacrum goes back and forth and acts like a pump. When your sacrum gets locked up, when there's a subluxation or misalignment in your sacrum, if you want to know about subluxation, I think go back about 3 weeks, I talked about the subluxation. It locks up, it freezes, it doesn't move now, and now your pump's broken. And these are horrific headaches. Your brain's not getting the spinal fluid to regenerate, do the thing it's supposed to. But these headaches are the cause of these because there's a real interesting symptom that goes along with these headaches. You lay down flat. If you lay down flat, the spinal fluid will level off and the headache will go away. You stand back up, you get your headache back again. As soon as you start walking, you lay down and it goes away. So that's an easy one for us to fix. Now we would find that by our x-ray exam, our chiropractic exam, and just your history like you always do when you come in. But those are the easy ones. Let's talk more about the more common cases. Problems in the upper two bones of your neck, your C1 and your C2. C1 is also called atlas, C2 is called axis. C1 is called atlas because it's a big round circle with two giant masses on the side. When we take your x-ray, I always tease it kind of looks like a bow tie because it's got these two big trapezoids on the sides. And C1 has a little pivot point that sticks up. I call it your tree stump. And the C1 wraps around that C2 tree stump, and that's how you tell people no. So it's called the axis because the C1, that's its axis to turn to tell people no. And the C1 is called the atlas because it holds the weight of the head. Kind of like in Greek mythology, Atlas carried the globe around. So we have C1, C2, atlas, and axis. And what happens is, I'm going to get into a little bit of anatomy here of the spinal cord. The spinal cord comes down through other vertebrae and goes out. Ends at L2, L1 area. And then it just becomes, they call it quana. It looks like a horse's tail. That's why they do spinal taps in your lower lumbar because there's no cord there. But we're talking about the top. So you have a midbrain. And your midbrain is like your coordination center. When we do neurological examinations on your midbrain, it looks a lot like a DUI road test from what I'm told. I've never had one, but from what I'm told. We check to see if you can do the finger to the nose. We check to see if you can walk in a straight line. Because your midbrain's all about your coordination. And when you drink alcohol, the coordination goes out the window. That's why some of us become better dancers, because we have no coordination. So it's better to have sloppy than none. But nevertheless, the midbrain gets suffered. Now, what happens? You're supposed to have a nice round curve to your neck, like a C-shaped curve. We talked about last week, you can lose that called technique, and you lose that posture, and you put the cord under stress. Now, the spinal cord has ligaments that come out from the sides and grab on the walls of the spinal canal. They're called dentate ligaments. Dentate like dentist, because they look like little teeth. These ligaments are strong ligaments, really strong ligaments. Like when we were in spinal anatomy class, trying to cut these ligaments was very challenging. These are very aggressive, strong ligaments because they're not meant to break. So if you've jerked your head around or had injuries, or if you walk around with bad posture and just move wrong 1,000 times over and over again, the neck's going to go back and forth. It's going to be under stress and tension, and something's got to give. If your spinal cord does not go up and down, what's going to give? That midbrain is going to start coming through the hole in the base of your skull called the foramen magnum. And when that midbrain starts to come down through that hole in your foramen magnum, it clogs it. Now, the blood vessels are going to get into your brain, no problem. In the old days, they used to think, maybe you're not getting enough blood to your brain. Drink some caffeine, get the accelerator going, see what happens. Today, I have a friend in Jacksonville, Florida. His name's Dr. Longyear. That's exactly how it sounds, Longyear. He's got a motion MRI machine, meaning that we can watch you bodily functions inside the MRI machine. We could watch you digest a sandwich in the MRI machine. Pretty cool, right? He's got his adjusting device hooked up inside this motion MRI machine. We are watching chiropractic adjustments inside of a motion MRI machine live. We're seeing exactly what happens. And he has showed us and demonstrated through several studies that your blood going into your brain is rarely ever compromised. That's rarely the problem. That's what we used to think. That's what I was taught. That's what my dad told me. That's what he was taught. That's what we used to think. Not true at all anymore. Not true at all. It's actually so much cooler. When that midbrain comes down, it clogs that foramen magnum, puts pressure on that. When you get the upper cervical adjusted properly and correctly by a chiropractor, it actually pops it back up. The midbrain will go back inside the cranial cavity, especially what they call the cerebellar tonsils. Not the tonsils your dentist, your nose stroke guy removed them necessarily. It's different kind of tonsils. But those pop back inside. And what happens, the venous flow, the return improves. So when you get those throbbing headaches, because the blood keeps going in faster than it's coming out. And you get a pressure buildup because that blood's coming in at this rate, but coming out at a slower rate, creating the back pressure, throb, 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 throb. And when you get the chiropractic adjustment and that stuff's freed up and the venous flow comes out, you could get a little lightheaded for a couple seconds because of the change. Very common. Another thing that happens, very common, spinal fluid dump. We take care of a lot of athletes, and we're seeing a lot of athletes today who are committing suicide by shooting themselves in the chest because they know something's wrong in their head. Very sad. But my chiropractor friends, like Dr. Scott Rosa, R-O-S-A, are discovering more and more that they've got their midbrain coming through the foramen magnum and their spinal fluid can't regenerate. Spinal fluid is going to pull the toxins out of the brain and bring stuff in. LDL is a huge factor on this, so if you've had head injuries and they tell you have high LDL and it's dangerous, you might want to think twice about that. But spinal fluid's up there. It's got not getting out. Toxins are building up inside the brain. These athletes are doing crazy things. And sadly, so are our veterans. You have a bomb go off, you get that head injury. So Longyear has dedicated a lot of his time to help with veterans, which is incredible. That's why I like studying with this guy. But we're seeing this happen. We're watching that C1, C2 move and that spinal cord pop back in. I bring my table up and you're like, whoa, I'm a little dizzy. Your spinal fluid is regulating. After about 10, 15 seconds, that level's off. And so it's really cool for me when they tell me I'm a little dizzy. They're scared. I'm like, no, this is awesome because we're going to fix your spinal fluid flow and your venous flow. Your headaches are going to get better. Your nervous system is going to get better because the spinal fluid's been drained. You're going to overall improve yourself. So if you're someone who's had neck trauma, if you're someone who has really bad neck posture, and you're someone who has a lot of headaches, a trip to the chiropractor might be overdue. And if you're someone that's really worried about dementia, I don't want to have dementia when I'm older, a trip to the chiropractor is definitely overdue. Because that part of what happens with that CTE is they get forgetful. Like the Bears quarterback, when he had it really bad, he had a picture of his house and his girlfriend on his wrist. So he got the mail, he knew which house to go back to. And when he walked in the house, he wouldn't freak out the woman in the house because she was on his wrist and he was supposed to be there. You think he was going to have dementia? But then Dr. Scott, like I said, found him, adjusted him, corrected him, now he's back to normal. Go on to YouTube, type in Jim McMahon Chiropractor. He did amazing work with him. So who do you ask? I'm going to a headache specialist. I'm thinking about going to see a chiropractor. What do you think? That's a bad person to ask. Really bad person to ask. Because they're not a chiropractor. They don't know what we do. I guarantee they have no idea about Longyear's studies and work. Ask them. Have you heard of Dr. Longyear out of Jacksonville, Florida? Have you seen the work he's doing with headaches and CTE and head injuries? Or Dr. Ted Carrick out of Harvard Medical School in Boston, Massachusetts, chiropractor. They don't know these things. So if you have these problems and these issues, go see a chiropractor, ask a chiropractor. And if you're an athlete, by all means, if you've had a lot of time down with head injuries, by all means, go see a chiropractor. You have to. Don't let anyone tell you it's dangerous unless they're a chiropractor. We have every single thing that we've been trained to know when we shouldn't take care of somebody, when we need to refer out. Trust me. They mentioned that in chiropractic school. It's an important class. We're definitely taught when to refer out. We don't need anyone to tell us. I think that's comical whenever someone says, I checked with my doctor to make sure it's okay. I come here. I'm like, really? I bet your doctor has no idea what's actually safe or not safe. I call them all the time and say, what about this technique? What technique is that? I said, stop talking about chiropractic if you don't know the basic toggle recoil adjustment. Go ask a chiropractor having problems. And if you're in Rockford, Illinois, come see me. I'll be happy to give you a straight honest answer. Thanks for tuning in. Talked a little bit about athletes. Let's dive into athletes next week. I take care of a lot of athletes. I'm part of the Pro Hockey Chiropractic Society, and I'm a board member of the International Chiropractic Association, our national associations, Sports and Fitness Science Council. Let's talk about why we see athletes. Thanks.